All right. Hi, everyone. My name is Cassandra Gonzalez, and my capstone presentation is long-term cardiometabolic risks among acute lymphoblastic leukemia childhood cancer survivors treated by bone marrow transplant. First, I would like to thank Jill with Pediatric Endocrinology and Hashim with Pediatric Hematology and Oncology for the guidance that they have given me throughout the entire process of this chart review and this capstone paper and the whole project in general. I'd like to thank Dr. Caldwell for guidance in the capstone process. And then I would also like to extend a special thanks to Jennifer Thurston, who never ceases to save the day, or never fails to save the day. So as we can see here, acute lymphoblastic leukemia, or ALL, as I will be referring to it for the remainder of this presentation, is a cancer of the blood and bone marrow. It affects premature lymphocytes, a type of white blood cell. ALL is the most prevalent of all childhood cancers and progresses rapidly if left untreated. But with improvements in clinical care and treatment, survival rates have reached about 90%, as you can see here, compared to the 10% one would have expected in 1968. Children with ALL are living longer lives. However, recent research shows that this population is at a greater risk of developing chronic disease, at a risk of 50% compared to 38% of the general population. Of these chronic diseases, it has been well documented that cardiometabolic diseases prove to be at a greater incidence for these childhood cancer survivors. These include obesity, hypertension, type 2 diabetes, and metabolic syndrome. Of the organ systems most impacted, the endocrine system has been consistently reported, with about 50% of survivors experiencing at least one endocrine disorder in their lifetime. More specifically, metabolic syndrome affects around a third of all survivors compared to 18% of the general population. The clinical risk factors here: high fasting glucose, abdominal obesity, high triglycerides, high blood pressure, and low HDL, leave this population at a greater risk for developing other cardiometabolic diseases and early death. This population is at a greater risk for disease due to anti-cancer treatment, such as radiation therapy and chemotherapy, which causes hormone imbalances. Little is known about the effect of bone marrow transplant. So to date, there has been limited research regarding cardiometabolic health in ALL survivors treated with bone marrow transplant. This study aimed to fill that gap, as well as identify corresponding risk factors to document the need of improved treatment and clinical care. Finally, an animated resource was created to improve patient and parent understanding of these cardiometabolic diseases. The study was designed to test the hypothesis that children who undergo more invasive treatments, such as bone marrow transplant, will have higher incidence of cardiometabolic risk factors compared to the general population. This was a COMERB-approved retrospective chart review of electronic medical records at Children's Hospital, Colorado. The charts included patients who were diagnosed with ALL and received their bone marrow transplant between January 2008 to 2020. The data was collected from the EPIC database and tabulated into the REDCap database. So moving on to the results. As we can see here, the majority of the population was white, non-Hispanic, and male, with a median age at diagnosis of 11 years old. The majority of patients fell in between the 6 to 22-year age range, with patients as young as a few months to as old as 22 years old. So now I'm going to orient you to my remaining results over the next few slides. I'm going to show you figures of key outcomes we measured for our ALL patients. Each slide will show longitudinal data from baseline to 3, 6, 9, 12, and 24 months post-transplant, along with the mean reported outcome for each outcome. Sorry. So, reorienting you to this slide. As we can see here, at baseline, 37% of our population was overweight or obese, with fluctuations along the 3, 6, 9, and 12-month time points. When we arrived at the 24-month time point, we can see that the value was maintained and there was no significant difference. Below, we can see 21% of the population at baseline was obese. Over here, we can see that 24 months post-transplant, this number decreased to about 16% of the population. Here is hemoglobin A1C. We can see at baseline, the value for HbA1c was 6.4, which is a high value indicative of prediabetes. We can see here at 6 months post-transplant that this value increased to 6.7, which is indicative of diabetes. However, at 24 months post-transplant, we can see that this number decreased to 5.0, which is a normal healthy range. So in summary, a total of 68 patients with ALL presented to Children's Hospital Colorado for bone marrow transplant between 2008 and 2020. The majority of our patients were non-white Hispanic males with an average age of 11 years. Our preliminary data suggests no immediate changes in overweight or obesity status among patients within the 24 months post-BMT. At baseline, patients had an average A1C indicative of prediabetes, which further increased 6 months post-BMT. The next steps for this project are to assess cardiometabolic risk among patients and identify changes in cardiometabolic disease risk factors over time. The results will be used to guide the development of prevention strategies and treatment for cardiometabolic disease among patients with ALL treated by bone marrow transplant. These survivors will receive a full metabolic workup 2 years post-BMT. Those that are diagnosed will be placed in intervention. And then, as you can see here on the right, I created an animation, and this animation will be used to enhance the understanding of cardiometabolic diseases in patients and their parents. Thank you.
Excellent job, Cassandra. Any questions? Anyone want to unmute or post a question in the chat? Just a lot of congratulations so far. All right, well, great work. I think we'll move on to the next speaker then.